A scary new study is out about cancer in men. The research published this week projects an 84% increase in cancer cases and a 93% increase in cancer deaths among men globally by the year 2050. The questions are now why and what do we do about it? Joining us now is Yale Cancer Center Director Dr. Eric Weiner. Doctor, thank you for being here. Appreciate it.
Sure, happy to be here.
All right, let's talk about this study first. This is a global study. Cancer projected to affect men most over the age of 65. Let's talk about the causes here. Do we have a good handle on what the cause of this projection is?
Well, in terms of the specific cancers, they're the cancers that afflict men in general. So prostate cancer, pancreatic cancer, esophageal cancer, lung cancer, importantly. And much of this increase is taking place in countries around the world, not in the United States, and particularly in countries that were characterized as having a low human development index, or what we often think of as low and middle income countries.
Some other factors they tick off in this study, too, along with the income of the country. Things that men have fewer screenings, go to the doctor less, things like smoking and drinking. Talk to me about those things. Are those typical in men in this country as well, I'm assuming, to some extent, right?
To some extent, they are. And men in typical are exposed to more carcinogens, both carcinogens that they have some control over, such as smoking and drinking, but then other carcinogens in the workplace. So that's a problem in and of itself. And then men typically, and this is true in the United States and it's true around the world, are less likely to have early detection because there are fewer screening procedures for some male cancers. But more importantly, I think men are less likely to take advantage of some of the screening approaches that we know work. So in this country, we know that men are less likely to take part in colorectal screening, a screening modality that's hugely beneficial.
Right. And what advice can you give to men or people who have men in their lives? What advice would you give them to give to the men they care about?
Well, again, this study was largely focused on the entire world, not on either our New Haven community or the U.S. But I do think early detection is important. We've seen the benefits in a number of cancers. Again, I specifically want to talk about both colorectal cancer, where screening is hugely beneficial, and where now the guidelines are that people should be screened starting at age 45, but also for people who smoke cigarettes and have a high lifetime risk of lung cancer. We know that lung cancer screening is effective. So I think we should encourage the men in our lives to take advantage of healthcare that's available and to make sure that they receive it.
Go to the doctor. Yeah, Dr. Eric Weiner from Yale. Appreciate your time. Have a great weekend.
Thanks for having me.